Next, let's talk for a few minutes about the specific vein pathways where these catheters go. The vein pathways that a peripherally inserted central catheter will run through include the basilic that is at the antecubital and very inner aspect on the inner upper arm. That catheter will advance up through the axillary vein in the outer chest, through the subclavian vein at the midclavicular area, through the innominate, what some people call the brachiocephalic vein, just below the head of the clavicle, and will then advance into the superior vena cava. That superior vena cava being a very, very large vein with a very high velocity, turbulent blood flow. The first thing that you see is a 10 milliliter barrel-sized syringe. This is critical. When a smaller barrel-sized syringe is used to instill even a milliliter of medication into a PICC line, using a 3 milliliter barrel-sized syringe, there is excess pressure created just by the very fact that the barrel of the syringe is smaller. Please honor all patients' complaint of discomfort. Now you see in the next area those approaches to reduce legal claims. Maintain current practice. What we did 10 years ago is in some situations no longer acceptable. We learn more all the time. So when we have those combination of signs and symptoms, pretty much we know that it's a thrombosed catheter. It will depend on where you are, what your organization, institution, policies, and procedures are, what assessments are done to either verify that a thrombus indeed is covering the surface of the catheter, or whether just by the signs and symptoms that we've become familiar with, the catheter is discontinued.